Chairman Sodell, we do have a quorum.
Okay,
So if you'd like to begin, I did reach out to Bobby. I just texted him to let him know that we were going to start because he did say
Okay,
he was
we-
going to one. So
okay, good. We have a lot to do, so I'd like to start. Could I have a motion to approve our last minutes?
I'll move it.
Second.
Second, thank you, Wayland. All those in favor, please say aye.
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 Any opposed? The abstains? Carries by unanimous vote. Thank you very much.
here comes Bobby's coming.
Okay, what I'd like to do is I'm just going to assume that people have had a chance to read the operating report. If there are any questions about it, I think we'll entertain them now because I'd like to spend most of the time on the budget. So let me ask if there are any questions on the operating results for, I think it's October.
Chairman, good evening to everybody. Both Chairman Finance and Board Chairman Bob Detour. So good evening to my board members.
Hey,
And I
Bobby.
see John Donnelly join us. John, welcome.
Thank you, Bobby. How are you?
Work hard. Good to see you.
Been a long time.
Yes. And thank you being on. Chairman, I'm sorry if I missed something. So
Bobby, we approved the minutes from the last meeting. I don't know if you had any comments on that.
the good part is today, Chairman, I left all my paperwork in the house. So I hope you forgive me. It's going to be very easy evening for, I see how happy Jen is for Rich Rank. And I congratulate approving it. So I hold myself back and thank you letting me know. It's very easy. I don't have too much today and I'm not as smart. I can remember everything. And my sister Jen, I hope she's prepared to ask every question. I will listen. No, seriously, good to hear all of you and to see you tonight.
Well, thank you, Bobby. What I'd like to do now is turn to the 2021 proposed budget. And I'd like to start in order with Jan and asking her questions and Rich's response. I think we could all learn something from the questions and the answers. Jan, if you wouldn't, are you prepared to ask your questions?
You know what? I thought that Richard was gonna just answer them with his notes, so I didn't. I'll have to look for mine now.
Okay.
If I could suggest, initially, I said I would do it in a presentation. Because of the extent of the questions and some of them were very specific, what I tried to do, and I hope everybody got the emails and all, I tried to respond to each question so that the committee members all had all of the questions and all the responses so that if there's follow-up questions, we could entertain those too. What I'd like to do, if it's okay with the committee, I've, based upon what those questions were, I've put together a specific pages from the budget and some of the summaries and all, and some of the information I sent to everybody, just the key pieces so that I could go through it in a briefer way rather than going through page by page, 33, 35 pages. But if that's okay with you, I'll do it that way. Otherwise, if you want to ask questions, we can do it that way.
Well, why don't we start that way, Rich? And if the committee members have any questions along the way, we will then intercede at that point. So why don't we start?
Chairman, may I have
Yes.
a
Yes,
comment,
Bobby.
please?
Sure.
Since I stated, I usually have 50 questions. That's why Jen was laughing, because knowing that I don't have one, but I will find one if I can remember it. If this be okay, if I can send those questions to you as well as to Rich Rank. Even if you say no, I still going to send it anyway. But I would like
say
to,
yes.
but I like to humbly request that if I can send all that tomorrow, since I forgot all my paperwork at home.
Sure, that's okay. Yeah, that's quite all right, Bobby. All right, Rich, it's your show now.
Okay, could you do the budget presentation attachment? Yeah. Okay, all of the committee would have received at one point. What I'd like to do, these 12 pages are just go through some of the highlights of the budget. And I think some of this you've seen before, so let me just run through it briefly.
Can I ask everyone to go on mute unless they're discussing something directly?
Okay.
No, that was the hospital. It's our paging system.
Okay,
Just to point out, on the key issues page here, just to refresh everybody's memory, if we didn't do any actions in the budget, we were projecting a loss of $167 million. What the budget included in that to offset that was $51 million in budget initiatives and operational changes. About $33 million is expense reduction, and the other difference of about, I think it's 17 and change, is revenue enhancements. The budget that we're presenting tonight is a budgeted loss of $116 million. The reason that the loss has grown to that level is evident, and I will go through this in the slides in a few minutes.
Can we mute everybody?
The operational revenue on the next section down, if you look at that, the first line of the operational other operating revenue, you can see that from 2019 to what we're expecting in 2021, our other operating revenue has dropped by about $114 million. Yeah, John.
can we enlarge that? It's a little hard to see, Rich.
Sure, okay.
Thank you.
Okay.
A little more. Good.
Okay, you can see it right there. In 2019, we had 222.9 million in other operating revenue. And in 2021, that same bucket of revenue sources is only 108 million. That's the difference, and that's why our loss has been growing. Just scroll down a little bit. And I'll go through that in the slides. I'm gonna go past the patient volumes because I have slides on that as well. But on the expenses, some of the committee members had asked, you know, how certain is this that we're going to have these expense reductions? And you can see that from the budget this year of where we budgeted to have almost 3,700 FTEs, the 21 budget is equivalent of only 3,400 FTEs. We've accomplished that savings throughout this year in a relatively painful way. And I'll show you that on the FTE slide, the next slide that we'll do. Before we get there, the last piece on this
Yeah, but before you go to the next one, can you please state what is FTE stands for?
Oh, I'm sorry. Full-time equivalent of an employee. In other words, if we have two part-time employees both working half-time, they would count as one full FTE, full-time equivalent. That's what the FTE stands for.
Thank you.
Okay. The CARES Act, in the budget, we have a little less than $7 million in CARES Act revenue that's in the budget. It's specific to the visitor screening that we have to do for COVID, additional lab testing, pharmaceuticals, and security. In addition to that, it's lost revenue at AHP and the outpatient only in the first half of the year because that's when the CARES Act revenue has to be spent by. Let me just go to the next slide where we talk about the FTEs. You might have to make this a little smaller to show the summary, and I apologize for that. But the highlighted amount, you can see that from the budget this year in 2020, we are favorable to budget by 366.6 FTEs. That we've done, as you recall, the volume dropped off during the COVID crisis. the intensity of patients picked up. And what we effectively did is, as people left because of COVID, and we had a bunch of nurses that were, they had deferred their retirement. When COVID hit 1 month, I remember we had 20 nurses that retired. So that downturn in our employee complement, what we've attempted to do, and we're still doing it, and you'd see it in the October financials that we just talked about, our payroll has been way under budget, and our volume is now picking up. Our census.
Mr. Rank,
Yeah.
Chairman, may I ask a quick question to Dr. Bhutan here?
Sure.
Since you said, Mr. Rank, that I don't like to use the word bunch of nurses. They are our employees. They are not just bunch. Please be respectful to our employees. Number one. Number two, when those dedicated employees left, I'm only concerned that there was no compromise. What is under the law was done or getting done or continue to be because of those, our dedicated employees left. So I'm asking that question, is that there any shape was compromised or there was no effects, and why not? As I understand, there's a requirement how we had to treat our patients.
No, there was actually no compromise. In the middle of COVID, you know, or right before COVID or right after COVID, a lot of people left, but we had our residents and the rest of our staff stepped up to help with the gap. So the patient care and everything else, it was very robust.
There was no compromise.
No.
Okay, the only thing I complimented the comment is I didn't mean disrespect in that we did lose 20 nurses in 1 month for people who did retire.
Yeah.
Okay, so that didn't.
Rich, just a question. Can we close that panel on the right? Because the numbers still are pretty small there.
There you go.
And enlarge that a little? Okay, and thank you.
Okay, I mean, you can see, and if you go down to the blue box down below this, if we just scroll down, you can see the trend of how the full-time equivalents have been trending all throughout this year. That's a summary month over month based upon payroll records. Starting off, let me just go to NUMIC, the part on the left. In January, we had a total complement of 2,657 FTEs. And if you scroll down through October, you see how that dropped off. Likewise with nursing and with A. Holly Patterson. We've been scaling back staff as we could, and the budget contemplates keeping staffing at the lower level and treating more intensely ill patients as we talked about, and we can go through that with the revenue recognition. As everybody knows, our case mix has been up all year because of COVID initially, and because of less people coming to the ED, but more sickly people. Right now, our case mix is about 10% higher than we historically have seen, and that's how we budgeted the revenue for next year.
Rich, the question I have is when you talk about the reductions in staff, and that's part of your pickup and your cost. I asked this question, and you tried to answer it, but if you had the reduction in 20, how does it inure to a pickup in 21?
Because we're going to retain our staffing at the current levels that we have.
But then when you do a new budget for 21, are you doing it based upon the staffing that you have?
That we have currently.
And then how is there a pickup? That's why I don't understand where the pickup comes in of savings, because you're rebudgeting for 21 as a base, based upon your attrition in 20. So how do you get a pickup in your 21 budget? I'm having trouble understanding that.
The analysis in the budget starts with the 2019 actual results and what we budgeted in 2020. And as you've seen in all of the monthly financials, our salaries right now through year to date through September, our salary and fringe benefit is $19 million below budget right now. And that includes 8 million of COVID expenditures during the crisis. So that's $27 million below the budget that we had for this year.
Yeah.
And what we're planning to do is retain that lower level of salary and fringe benefits.
Well, when you did the budget that started off at 167.5 million loss, what
Yes.
staffing level did that have in it?
That had the staffing level that we budgeted, because it was a comparison to what we budgeted before COVID
Budgeted for 2020?
or actual 19. It's the same numbers because we use the actual from 19 through October.
Okay, I don't know. Maybe it's just me. I'm struggling to figure out if you actually experience the savings in 20, how you have the pickup in 21, because your budget for 21 would be based upon. But you're saying your budget.
You can't, I don't know if you can budget 21 based on 20 because we're in the middle of a COVID crisis. You have to go back to where our baseline is 19.
So
Yeah,
you
and
get to your, go ahead.
Yeah, Bob, I think that's the issue, that we went back to 19 and our staffing levels were higher in 19.
Yeah.
What we've experienced this year allowed us to bring down our staffing. And what we're seeing is our census is now at 324 today, where we
Yeah.
budgeted an average daily census of 322 patients.
Okay.
Okay, may I ask a question there?
Well, Bobby, can I just finish my thought here?
Yes, actually, you are actually asking my question, so please you go first.
Okay, thank you. I'm just struck. So, but all I'm trying to figure out is when you started with 167.5 million loss, was that was based on the 2019 numbers?
Yes. Yes, because.
All right. So you're saying that the 2019 numbers compared to what the numbers would be this year are going to be less than you budgeted, but you still had that pickup in 20. Okay, well, I won't belabor it, but I'm struggling in my
Yeah,
mind to figure that
Bob,
out.
that's just for the analysis, but what we did, our budget is based on our current complement of people.
Right, I understand.
And that shows that $30 million savings or $33 million savings already.
All right, will that be a cash pickup?
Yes,
It will be. Okay, all right.
yes.
Bobby?
May I now?
Yes, sure, I'm done. Thank you.
Richard, I see that you're saying, and Dr. Booton said we had the base from 2019. If I understood correctly, even though I don't have my paperwork with me, the notes I made, I see why Bob getting confused. I actually was confused on that point myself. Without the papers, I couldn't even ask a question. So I'm glad Chairman Detour asked that question. I'm still confused. I actually confused what you're trying to do, how you're trying to do is not making sense to me, but I will have those questions in writing since I don't have in front of me, so I can't eloquently can ask, but it is very confusing. And to me, my concern is you to have a higher level almost your patient and have lower level of your employees, especially when you're talking about the nurses. That cannot be compromised under any circumstances. And I want to make that as abundantly clear because that is a health violations and we cannot compromise. Please make sure you keep that in mind. There is no patient care will be compromised under any and all circumstances. That is my humble request. And that's also, I hope, is a committee and board members' order to our staff.
Rich, I gotta agree with both Bob and Bobby here. I don't see how the 2021 shows a reduction that warrants saying that you're gonna have a staff. That implies to me that you're gonna have a staff reduction in 2021. And I'm not sure I'm seeing that. I've got the same problem that I think those were attributable to things that happened in 2020. And I don't see where they materialize in
Pull up a little bit. Okay. Yeah, let me show it this way. If you look at this top part, you can see here that and budgeted 2020 is equivalent to actual 2019. We budgeted, if you see on that right side, a total full-time equivalent of 3,669 FTEs. We're currently right now running in October, 3,302.9. What I did with the budget, I started with 2019 or what we budgeted in 2020, which was the $86 million loss, as you'll recall. And I had to do that because we had to eliminate the impact of COVID to show what we're going to do next year. Because COVID's been so radically different, everything from the CARES Act revenue we've gotten to the district money we've gotten, and all of the impact of the crisis, the higher intensity during the crisis. So what we did is we took our current complement and with a starting point of the 2020 budget of $86 million loss, if you recall in the narrative of the budget, we started there. That $86 million loss was predicated on having 3,669.5 FTEs that we budgeted. If you look at the October financials now, we're $27 million favorable to that in salary and fringes alone.
Rich, Chairman, may I?
Let me ask this another way. What is your budgeted FTEs for 2021?
If you go, just scroll up to the prior page. We have a complement of 3,397. However, there are additional FTEs that we've budgeted for specific things, such as the new programs at AHP, the additional amounts that we have for the lab because there's additional testing that's covered by the CARES Act. There's the pre-screening of employees of patients and visitors that we have to do. So what this comparison here, as it says on the left side there, is it's budgeted FTEs excluding new FTEs in the budget for budget initiatives and operational changes. But that shows you that drop off of give or take 300 FTEs.
But what's your actual FTEs? Isn't that really 3,300?
Yes.
So where is the pickup? I guess I'm back to Bob's question.
Because we started with the budget for 2020 as a starting point.
So what you're saying is that in the 2021 budget, the dollar value for employees or salaries is equal to what it was in 2020, as far as a budget.
At the current time, yes.
So what you're saying is that, make sure I understand this. So that's for now. Now I see it. So you budgeted 3,669 FTEs for 2021, but we currently only have roughly 3,000, let's say 400. So you don't anticipate spending that money that you budgeted.
Right. Bob, we budgeted that 3,669 for 2020.
How about 2021?
2021, we have the 3,400 FTEs.
Okay.
So we're back into the same position. the drop off in 2021 that warrants a savings.
So Rich,
It warrants a savings only because we started with the budgeted number, the budgeted amount, the budgeted loss for 2020 as a starting point.
if I may, it's John. So Rich, you're saying the savings on the FTEs is roughly the 200 plus difference between 20 and 21.
Correct. What we budgeted in 20 versus what our current complement of employees are right now, that's the savings.
And that's how you're getting your pickup, because you're comparing it to the FTE in 20 as what was budgeted in 20, as opposed to the roughly 3,400 for 21.
Correct.
Okay.
Okay. Yeah, Chairman?
Sure, go ahead, Bobby.
Okay. I have two questions. As you all know, the person you replaced, he had presented the budget of 2020. And you know, I trusted him almost -0. So anything you're doing based on his report, my trust drop equally on you then. Because I'm going to tell you why. He never was open and honest to the board. And that budget never was honestly prepared, never was honestly presented, never was honestly voted. And please do not confuse me. Maybe the other much more smarter than I am. I can see at least Bob pulling his hair to justify, Bob, I'm sorry, at least they can implant the hairs. Mine is, I don't know what I want to do with it yet. But point I'm making is, did you, you are only a finance guy. Yes, I understand you presenting the budget. Did you any time ask Dr. Booton or the other chairs, wherever these employees you are taking from or not, is there a compromise of those our employees or not? If you did, tell me who you asked before you did any deduction or not. I'm not talking about the money. I'm talking about the employees. There is a law what to do with as per patient, why we require the nurses, why we require some assistants. So question to you is, did you or you did not?
Yes, I'm presenting the budget, but this is not my budget. This is the hospital's budget. It was discussed with Dr. Booton. It was discussed with Janice Pateras, and all of the departments prepare their piece of the budget. We only, in finance, accumulate this data. We don't dictate to the operating departments what they can and can't do.
Okay, then I'm going to turn that question to Dr. Booton. Dr. Booton, not the money part, is staffing. As you know, it is required under the law or the health law. Is there any compromise? Employees.
So
For the patient care.
I met with all the chairs and I told them my goal. I said that we cannot continue running the hospital the same way we've been running it for the last several years. We needed to make sure that we reduced our cost, cut overtime, and again, safety is always my concern. And I specifically said for them to look for savings and bring it to budget. So, and I'm looking across the board for a 20% reduction. Some people were able to do it. Some people were not able to do it. Some people were able to do it in staffing. Some people were able to do it in supplies. So we're working with what we have, making sure that it's safe. Or if we couldn't do that, at some point, then we would have to reduce services that we just can't continue doing. So as opposed to cutting services, I told them to cut waste more than anything else. So that's what we have. Again.
Dr. Booton,
on a
there
day-
is nobody the more supportive
Hold on a
to you
second,
than
hold
me,
on.
and
On a-
you know that.
On a day-by-day basis, I've been following the entire operation of the hospital. If there's compromise, I would be the first to know about it, and I would do something about it. We are trying to supplement our staff with agency. Now, I know that we're in the middle of a crisis. What we were able to get away with 6 months ago, we can't, because the entire country is under the same strain. And so we have to do what we have to do with what we have. And we have to make sure that our staff is safe, and that we protect them, and that we take it from there. So we're not looking to compromise anything. Again, on a day-by-day basis, we're looking at everything.
I understand that, but Dr. Booton, you also, I hope you understood what I'm talking about. I hope Rich Rank can understand what I'm saying. And I hope you guys share with the board members from the same level. The only reason I'm saying this, I want to make a statement to my board members, my colleagues, why I say that. There was a issue when I was the chairman on the board. It brought up to my attention that we was compromising on the patient care, how many nurses should be on how many patients, on how many services. Patient care cannot be compromised. That's my concern. That's all.
Okay, the only thing I would add is the staffing in the budget is the current staffing at the hospital. And to Dr. Booton's point, we run a safe hospital right now.
Rich, so going back to the screen that we have, these numbers are the beginning of the year numbers for 20 and 21.
Yes,
But in actuality, the 2021 number is what we currently staff at. Is that correct?
yes.
Okay. So I'm still baffled by if we're at that number, where the pickup is
I am too.
2021.
Because when we did the budget and for the budget analysis, we started with the 2020 complement of 3,669. That's, if you looked at the narrative, it shows that I started with the budgeted loss for 2020 of $86 million. That loss was driven by the complement of 3,669 FTEs. As you're aware, this year, we're favorable to budget by a significant amount for a number of reasons, including COVID. But the starting point, I think the point that that might be confusing everybody, the starting point was the budgeted loss of 2020. And that $86 million had a starting point of that 3,669 FTEs. When we did the budget, we did our current complement, which is the 3,400, and start with a starting point of the higher number of the 3,669. That savings is what we're trying to do with that reduced staffing that we currently have. We're trying to hold that reduced staffing at that level and see the same patients, at least on the inpatient side, that we've seen historically.
And when I see what you wrote, I would anticipate in 2021 that we would have a FTE reduction. That's the way I read what the assumptions were. And I guess that's incorrect because it's going to be the same level as earlier, so there will be no reduction.
There won't be any reduction from our current complement today. It's a reduction from what we planned for at the beginning of this year. Because we, like Dr. Booton said, our staffing levels were historically higher than what we're seeing and what we have right now. And we're trying to maintain that lower level of staffing to serve the patients that we anticipate serving in.
Rachel, I want to interject the question with Chairman asking, and I think it will make easier.
Okay.
My question, is to make for them and for me and whoever else is listening is very important. Let me ask you and Dr. Bhutan, I don't know, Dr. Bhutan have the knowledge or not, I'm sure he does. Now, what is the FT per patient ratio in our hospital, or what is actually required by the state or federal law?
That I don't know.
Yeah, I will say in
Who is this?
talking,
Is this Dr. Bhutan or is this, who said I don't know?
I did.
Actually, I know the answer to that question. The answer to the question is.
Bob, Chairman, before you answer it, let them say something legally.
all
You
right.
don't want to be responsible.
All right.
the way I can answer it
Okay.
is, when we were developing the budget, Janice Pateras has a staffing ratio by unit. And it runs everything from a 1-to-1 on the ICU units to a higher ratio of nurses to patients on the regular med-surg bed units.
So your answer appeared to me before I asked my chairman to give us the answer. You don't know either.
Janice Pateras.
I didn't ask
identified-
that. I'm asking you.
Well-
What is the FTE per ratio per patient? Do you know, yes or no, or what is required by the state and federal law? Yes or no?
I don't have that information here.
So Bhutan don't have it. He took 1 second to answer it, and I appreciate him. And you given me circle around. I do not appreciate that. And Chairman, would you be kind enough to tell us if you
Well,
have the knowledge?
I understand their dilemma because I don't know what I just did to this, but I understand their dilemma. It's that the state law does not require a specific number. The state law requires it's adequate. And the Joint Commission does the same thing. And they measure your adequacy by your outcomes. So there is no number, Bobby. That's the issue. So that's why they can't answer it. Janice puts together a nursing complement that meets the needs, that addresses the complexity and the acuity of the patients that she has to deal with. And that's essentially that's it. There's no set number in New York State.
Chairman, to my best knowledge, you may be 100% right, and you may be almost 110% wrong. So I'm not going to argue with you on that, but I'm going to argue there is a standard. There is a standard, and I humbly request Mr. H. Rank and our CEO to find out and make sure we are following those guidelines.
Okay. All right. So I just want to go back to Rich, and you'll find the answer to Bobby's question in Public Health Law, Article 28. I'll stop. This is my last time I ask the question. But for the staffing complement for 2021, if you had a complement of 3,397.1, and you start off with a budget that says there's $167.5 million loss, and then you put in here that you're going to do expense reductions, and part of the expense reductions will be staffing savings. But the staffing that you've got in there are I mean, the number is now less than you started with. So I can't understand where the pickup is.
Okay.
Am I lost here? I just don't understand it.
Let me go to the first page of the budget narrative, because the other attachment, the next one over. Yeah. You just go down to where the narrative starts. Keep going. Yeah, I'll tell you when. Okay, right here. Here's the starting point, the 2020 budgeted loss, $86 million.
Yes.
Included in that is the higher number of FTEs. So that's my starting point. I'm saying if we stayed at our current staff at that level.
Right, let me ask you, at $86.1 million, had a staffing level of what?
3,669 FTEs.
Okay, all right.
Okay? If we maintain that staffing, the rest of this chart as you go down shows what happens if we do nothing, if we didn't do anything from how we started 2020 or 2019 actual, same number. And it shows, like you see, district for 2021, here's what's going to happen. District goes away, VBP goes away, the New York State legislature or Albany is reducing our rates and all of that.
Yeah.
All of that happens, $61 million in reduced revenue added to that $86 million starting point in loss.
Yep.
You keep going down, then our contract goes up because we have a 2% COLA. The pension increased because of the meltdown in the market.
Yep.
And there's 20 million more in cost increases before we do anything.
I understand.
Okay, so if you just scroll down a little further, that's the $167 million.
Okay,
Our staffing level at almost 3,700 FTEs would drive a $167 million loss.
okay,
Based upon what we did with the budget and what we have done all through 2020 of reducing our staff as people left and making do with a less complement of staff.
Mhm.
If you scroll down, that's where you see the savings of the 33.5 million in reduced cost. It's not all FTEs, but it's primarily that. It's dropping down that starting point of 3,600 FTEs or 3,700 FTEs down to our current staffing complement of only 3,400. It's
Yep.
the starting point of starting with a
but
anticipating.
you made that pickup in 20.
That's right. It was a pickup all through 20 where we continuously dropped down the staff.
So where's the pickup in 21?
Because we're maintaining that level of reduced staff. We started with showing what we historically have. The 2020 budget is our historical level of operations.
Yeah,
That's the $86 million loss we budgeted for this year, that we thought we were gonna have that loss before COVID hit. And we would have had that loss if we did nothing with staffing, if we did nothing with anything else.
mm-hmm.
Rich, that 33.5 million, how many FTEs are in that as a reduction?
Oh, boy.
I don't have that number right here, but what I said in the slide that we were looking at with the FTEs, it equated to the reduction in FTEs going down to the 3,400. That equates to an average expense of about $92,000 an FTE.
Yeah, so for the 400 people, that's roughly the 33 million.
That's right.
So I'm with Bob here. It seems to me you're double counting it. You recognize it in 20.
I agree with my chair. I think you double counting it. I looking at it that way. I wish I have all my notes. I would be really, you would have all the hair standing up. I'm telling you, I am very much agree with the both chairmen. I'm not happy. I have too many questions. Don't do double dipping, whatever it is going on. Don't make it more confused. That's what the other guy did. And that's why I never trusted. So please, please, please make it as simple and don't make the budget so confusing to me or the other board member. I think it's like budgeting higher than playing the game. Please don't do that. If you don't know your job, please find something else.
No, well, I'm not suggesting that I don't trust you. I'm just suggesting I don't understand it, and there may be a misunderstanding. But for example, Rich, how will you measure this in the course of the year? How will you measure the pickup?
Well, let me back up before I answer that, Bob, to say I had to have a starting point before COVID in order to explain where the budget would be. I
Right.
can't start with our current operating results because there's so many things that happen with, we recorded
understand.
CARES Act revenue, we recorded DSRIP, we recorded VBP, QIP.
Right.
That I started with what our historical levels are of how we operate.
Right.
That just happened to be when we budgeted 2020, that we would have had an $86 million loss.
But
And
Richard,
then,
go ahead. I'm sorry.
and then what this is just for an analysis. And I was trying to start with that starting point to say, okay, what do we have to do? Let me say it a different way. If I said to Dr. Booten, I want to get back to the complement when we started 2020 before COVID for the 2021 budget, we would have had another 200 FTEs budgeted, and we would have had a loss related to that of about $33 million.
Mhm.
What the budget contemplates is every department took their budgets, knows what their current complement of people are, identified what overtime they did this last year and what they're currently doing. And we built the budget department by department, starting with the current roster of employees in each department.
Okay.
The $33 million that's shown there is just off of starting with a historical operating level. It's no savings from what we're currently seeing right now, because our staffing level is that low right now. The only reason it's there at the $33 million operating loss or reduction in operating costs is because we've brought our staffing complement down to that at this point. I think the confusing part is that we started with a historical level before COVID, and that's normally in a budget year, you would start, okay, here's what this year is, and here's how it's going to change going forward. We can't do that in 2020 because of everything we've experienced this year.
Is the dollar amount that you have in the budget line equal to, for 2021, is it equal to the 3,006 or the reduced?
I'm sorry, but what's the 3,000? Oh,
Is the dollar amount that you've budgeted for personnel
okay.
in the 2021 budget equal to the 3,300 or 3,397 FTEs or the 3,669 FTEs?
The 3,397.
All right. So now if the dollar value in your budget is that,
Yes.
then you're not going to see any variance to that.
I'm not going to see any variance to
Then how,
today's
then how do you have a pickup?
because of my starting point. If you go back up, the 86 million,
But you started here this year, and this next year you change the starting line. So there's truly no pickup in cash. I'm struggling with this.
I understand that.
One second, Mr. Rich Rank, before you answer, Chairman, may I compliment Chairman Bob Detour? Not that often I agree with you, but I have to say this. You absolutely eloquently asked that question. I wish I have my notes, and I thank you for that. Rich, I am equally stuck there with the chairman. Please be very simple.
The only reason I'm pressing this is because the cash flow, which we're going to talk about later, depends upon that variance of cash. So if you don't have a positive variance in cash, in that budget year, you really have no pickup in cash.
That's right.
That's why I'm stuck on this, because the assumption here in terms of I'm thinking of cash, but if there's no variance in it, how do you get any cash pickup?
Bob, because we're seeing that this year. Like I just said before.
I understand that. I understand you're seeing it this year, but this year's number that you budgeted was higher, and so there's a variance in there. You said you had a $27 million variance in the budget. I didn't go look, but I know in our October numbers to set to payroll, right? And that's
Right.
because that's the pickup that you got because your FTEs went down from 36 to 3397,
Correct.
Now, when you go forward, so that's your pickup. You got it. When you go forward to, and probably if you extrapolate through the end of the year, maybe you've got your 33 million. Now you go into 2021 and you're starting back at the 3,400 number. And that's what you're projecting as your expense. So there is no, and that is probably truly going to be your expense. So there's going to be no pickup because there'll be no variance.
And you said it right, Bob. There's no pickup from our current complement of staffing. No, but on this analysis, like I said, we started with the operating loss of $86 million,
I
which
understand.
considered a higher complement of almost 3,700 FTEs. This is just an analysis to explain it. The budgeted numbers, the actual numbers that we can go through in the P&L is our current complement of people. The cash flows that we've done historically was always before this budget.
But you got but Rich, in your cash flow projection that you sent to us, you have a $33.5 million pickup in cash.
From our historic levels.
Wait, it doesn't make, no. Cash is cash. It's either real or it isn't. You got it in your pocket or you had it in your pocket.
But Bob, the cash flows that we did were based upon our historic P&Ls.
Well, I'm just talking, I understand. I understand that. And that's why I'm pressing this issue is because it's based on historic. I understand that. But you're budgeting a number. That's okay. That's okay. And the number is what is going to be. And if the number is what is going to be, then it's not going to include a variance. And that variance is your pickup in cash. And that pickup flows into your cash flow. So your cash flow is underestimated. That's my concern here. That's why I'm pressing this point.
Right. No, and the cash flows that we've projected, if you recall, it started with the $86 million loss or 3,600 FTEs, and we've projected that level out for 4 years.
That was my other question. How can you project that for 4 years? Because you only get it once.
Because
in terms of budget, you get it forever. But in terms of operations and cash, you only get it once.
But Bob, if our cash flows that we started with the $86 million loss in 2020, and we took that and we ran that out for 4 years for the state, predicated on almost 3,700 FTEs, that's what drove those cash flows.
Oh my God, and if that's true, then your cash flow is overstated. Because you aren't going, I mean.
That's exactly the Bob Detour. I was asking question to a former employee the day you and I had a kind of confrontation. That was exactly my argument was, and I'm glad today you are asking the same question. And maybe I couldn't put it that day as eloquently as you doing it today. That was my question to him. It is another question I have. $86 million last year's budget before you arrived. Another board member who was on arrived. It was only 13 million. I was told. I was the chairman of the finance committee. And the next thing I know, it's 86. I don't know where that 86 came from $13 million. I even made a joke to the former chairman that he can write on it 13 million. I'm glad you asking the question, but my only one question, if I have a permission from the finance chair, because then I'm going to go have a family issue, is the question is nothing to do with the finance chairman. Since I have Dr. Bhutan and the others, is all our nurses getting their a proper N95 masks?
Absolutely. If they want it, they get it. It's
Can you
available.
be kind enough make it tomorrow issue to the entire staff? They do have it. If someone don't have it, let's make sure they have it. Make sure we have enough supplies.
Bobby, we talk about this every day. I brought it up earlier this week to the entire leadership team that if you're working in a clinical area, you're required to wear an N95. So we have it available, and
And I thank you for that report, because I had Dr. Booth and some of our nurses somehow had reached out to me and had advised me that they don't. I no need to disclose their names. I'm only sharing with you. You're a friend of mine, and I know you care about your staff. So if there's any shortage of N95, make sure we have them. Make sure our dedicated staff have it. There should be no compromise, none whatsoever, when come to the masks for our employees.
No, we
And I
have,
thank you, Chairman. If you need me for anything, please let me know. I stay, otherwise I have to go.
Well, thank you, Bobby, for your questions and your comments. Rich, let me dwell on this, because I'm having trouble as Bob has. And
I may be wrong. I just don't understand it.
if you look at
You are not wrong first time.
operational changes and budget initiatives, all of the revenue cycle improvements have yet to occur, right? They're going to be in 2021.
no, some of the stuff is,
No, some of the stuff was started in 2020.
But the savings
amount-
attributed, but the savings are 2021, I believe, right?
That's the piece that will be, that we will see in 2021. The
Right.
initiative started in October, November, like we started the observation unit. The amounts in the budget are only that which will impact 2021.
Great, I agree with that. But then we get to the reduction in operational costs of 33.5 million. So in the future, that implies to me this is going to happen in 2021. Where is it?
Because I had a starting point of our budgeted loss of 2020 before COVID, which contemplated that we would have a staff of 3,700 people. Throughout this year, we were able to bring it down to that 3,400, and now we're going to maintain it at that level. When you have a starting point of a loss of 86 million with that complement, I'm starting with that as a starting point. So our 36 is coming down to 34, and that's driving that loss.
I got that. But listen, the same way you say that some of the savings from the revenue cycle are in 2021 and 2020, so you're not counting them, that same logic should prevail when you talk about FTEs. The savings from FTEs that occurred in 2020 cannot be carried over to 2021. The logic doesn't make sense if you go from the revenue cycle savings, which are only those that are occurring in 2021. How then, where is this 33.5 million coming from?
Because we're seeing that this year. When we budgeted that $86 million loss, we budgeted to have 3,700 people. We've reduced that down significantly. And with this analysis, starting with the loss of 86 million, that's the difference between the staffing that we budgeted and the staffing that we currently have.
I understand that, Rich, but when you say here 33.5 million reduction in operating costs, where is that? Show me that in dollars. Where is that coming from? I'm assuming that that's at the 400 staff reduction that has already been attributed to 2020.
Correct. But my starting point was December 31st, 2019.
No, I know that, and I know why COVID throws out 2020. But I've got trouble recognizing that number. Can you break that number down for us to show us exactly how that number is and where we realized over 2021?
Yes, I can, because if you look at the October financials, the actual year-to-date variance from that budgeted 3,700 FTEs in salary and fringe benefit is $19,400,000. When you consider that 8 million is COVID-related expenses that we would not incur again, that comes up to the 27 million that I just said. And when I start with a loss that contemplated that high staffing, I'm trying to reconcile down to what we're budgeting for. If I started with our operating loss right now, which is significantly below what we budgeted by $54 million, that reduction in operating costs would go down significantly because we've already achieved it. But I'm starting with our historic levels before COVID to try to explain what we've done in this budget and what we've done from what we historically have done.
Okay, Rich, we've kind of beaten this subject to death, but I'm going to ask you for the reduction in operating costs to enumerate what exactly is in there, okay? Specifically, if it's FTEs, I want to see what that number is. Is that okay?
Sure, I'll get that to you.
All right. Sorry for the long dialogue here, but it's an important issue for all of us.
I agree, and I want you to understand it fully.
Okay.
Can you
so
go back
please
to the budget
continue.
presentation? Okay. I'm just going to go back to where we started. Just go down to the page after this one, not this one, the next one. What we talked about is this is a chart of our other operating revenue. And you can see, like we talked about before, that if you just scroll down a little bit, the blue line is 2019, yeah, just the other way. That's your 229 million that we experienced, or 222 million that we experienced in 2019. That same other operating revenue is now 108.8 million. That delta of $114 million is why our loss is where it is today. Just scroll down to the next slide. Just to show how we fund our operations. The chart on the left is salary and fringe benefits, and that is a comparison. That's the red boxes on that side. The blue boxes show what we get in net patient service revenue and IGT. And as you can see, what we bill for patient services and what we bill for the indigent care covers our salaries. If you look at 2021, we're going to have revenue of 447 million, and we're going to have salaries and fringe benefits of 441. So our billing and our IGT payment covers our salaries and fringe benefits. If you look at the right side, everything other than salary and fringe benefits or other than personnel services, you can see that other operating revenue used to cover most of those expenses. Again, the blue line is the revenue and the red line is the expenses. And you can see how that's drifted down and how we're now of $183 million in other than personal services or other than salaries and benefits. We're only getting coverage of about a third of that. Okay, just the next slide. I'll just show you what we're. Yes.
Let me stop you there. Go back to 2021, please. Slide ahead. Why
Sure.
salaries and benefits go up by 30-some million dollars if we have a level employment?
Because we have about $8 million in CSEA contracts, contract increases, the 2% COLA, which applies to not only salaries and fringe benefits, because like pension is a component that we pay a percentage of salary. FICA is a percentage of salary. The total amount is $8 million in increase just on that 2% COLA increase. Where this shows
Went up
the
$24 million.
the other piece is we have FTEs that we've shown in what we were just talking about. We have new initiatives. For example, the 2 new programs that we budgeted for the A. Holly Patterson. We have 10 FTEs to cover those 2 programs. In the analysis we were talking about, I showed the net impact of it. It was $1.5 million in revenue and $500,000 in salary and fringe benefit expense and other expenses for a net $1 million pickup. The complement we were just talking about with the FTEs is just those FTEs that we historically have seen. It's not the new programs and the new initiatives that we have built into the budget.
Okay. It's getting late, so I don't want to dwell on it. Please move on.
Okay, the next slide shows what we've done. with outpatient volumes. The inpatient volumes, the discharges, we anticipate coming back to the 2019 levels and we're skipping by 2020 because of COVID. But you can see, like in the general clinic, in 2019, we saw 162,000 visits. During the COVID crisis, the red bars, we went down to 131,000 visits. They have since bounced back, and we're projecting that improved trend back up to 151,000 visits. Mental health is higher than what we've historically seen, as you can see there. The emergency room, we historically have seen 67,000 visits there. It has dropped down to 57,000, and it's continuing to stay at that level, so we budgeted at that continuing level. And the last piece, which is a small piece, is the AMSurge. It's historically at 5,400 cases, dropped down, and it has since recovered somewhat, but we're not showing a recovery up to the historic level because we're just not seeing that yet.
What's interesting here is that the behavioral health hasn't really been affected by COVID.
Correct, it's actually higher, and there's been a lot of articles written about the mental health impact of the crisis on the population, and I think that's what's driving that.
Yeah.
Just slide down the next slide. This is a slide of AHOLI's resident days, and you can see historically we've been running about 165. It dropped down this year because of COVID. We had 100 expirations, 60 of which was in the Korean program. It has started to come back a little bit. It's not as bad as it was. What we've put into the budget is the implementation of a Chinese program and an Indian program, but we've started to phase it in the second half of the year. We did that in consult with everybody at AHOLI because they said if you do it any earlier, you won't see the impact of it because people are not willing to admit their loved ones to a nursing home when they can't visit them. And with the current visitation being limited by New York State, we at least projected that to start in the third quarter of 2021 and then ramp up through the last quarter of 2021. That resulted in 4,500 additional resident days that we would see out of that program. The last bar on the right side shows that if those programs are successful, and success being 100 new residents a day from what we have today in the Chinese program and 50 residents in the Indian program, that we would yield 55,000 more days than what we're currently at now. But that's not in the budget, just so you know. The only thing in the budget is the 4,500 because of the phase-in. Next slide. These are just the budget initiatives that the board asked for. It details out what we're doing here at NUMIC, everything from surgical interface to denials that we've seen in orthopedics that we've already started addressing and we've had success this year. The detox Medicaid denials that we've seen and we've corrected. It was an issue of billing detox and at psychiatric rates. And we've already seen, and we will see this year, a pickup of 350,000 in revenue there. You just go down that slow. And the AHOLI Patterson, there's two things. We've hired staff during this year for Medicaid applications. We hired 3 people to collect that $1 million. And we're going to work with a collection agency to collect the other $1 million, and that's already in the works now. That'll start early next year. The observation unit, Dr. Booten has talked about in the past. It was operational in October. The math on that is if we have 1,000 cases that were denied because they were observation, and we get the rates on those that we have with our current commercial carriers, and Medicare and Medicaid is in the range of about 2,000 a case. We currently get only 300 if that admission is denied and it's converted to an emergency department visit. That difference of 1,700 times those 1,000 cases is the 1.7 million. Just slide down one more. The outpatient is just expansion of that. And we just talked about the new programs at A. Holly. But the new programs at A. Holly, let's go back a little bit. If that's successful, that will generate somewhere between $16 and $20 million in revenue. And it'll cost us about $10 million in cost to run those two programs for a conservative net profit of about $7 million probably in the year 22 and 23. Again, that's not built into the budget. The only thing in the budget is a net $1 million during the phase-in of those programs. Okay. This is what everybody has seen in the budget. This is the consolidated P&L. I just wanted to share that with you. Just scroll down a little bit. And you can see just a little further, the 116 million that we talked about is what this is the actual, rather than the analysis we're doing off of, starting with 2019, this is what we would anticipate seeing, a loss of 116 million. The
Now,
next slide.
Wait, Rich, go back up on this.
Okay.
Up just to the, a little higher. Oh, right there. Okay, hold on. Now, what are we going to do with this net operating revenue thing?
The non-operating?
The total operating revenue. Remember, we've had a conversation about this. Where's? Because that's a reclassification from the audit.
This is 2020 and 2019. This reflects that reclassification. If you look at the DSRIP line, if you looked at the audited number, DSRIP for 2019 was in the range of 28 million.
Mhm.
It's now reflected here as 52 million.
Right.
This is just, for the budget purposes, this is just a comparison to show what we earned in each year. It's not reflective of what was in the audit statements. I reclassed that to 2019 because it was earned in 2019. And the amount that was earned in 2020 is in the 2020 column of DSRIP. And as everybody knows, the DSRIP program went away on March 31st, 2020. So that's why DSRIP is 0 for the 2021 budget column.
Okay, so, but I know you had some conversations with the auditors about this. Are they agreeing to that?
For audit purposes, we will reflect all of what we saw this year in DSRIP, the whole $50 million. It'll be a little less than that because we had a receivable. That will all be reflected in 2020.
So that $52 million figure will not be in the, is not part of the actual audited 2019 number.
Correct.
That has to be footnoted. People have to understand, and what the purpose you're showing that, I'm not sure, well, I know why we're showing it because of a strategy related to CARES, but from what I understand now is we can't use that in the CARES calculation. Is because it's not considered patient revenue by definition. Is that true?
Well, we'll have to have a conversation on that because I believe it can be profiled that way, Bob.
All right.
But that's not, that won't drive a change in any of the numbers for the budget, just to be
No, I
clear.
understand that, but I just want, the board has to have a clear, because the audited figure on that 607 million is $575,047,000.
Correct.
Which changes the drop down now. So you come down to the.
Yeah, drop down on this to the bottom line.
Right there. Yeah, right. Stop. So you in your income, you're showing a $10 million profit before, OPEB and GAS.
Correct. And the audit number is a negative 20.
Right. That's just what, yeah, okay. So I just, but the board needs to see that because they have to understand what's going on here. That's what my concern is.
Right. If I would do it strictly on what was presented, the $10 million for 2019 will be a negative 20 as it was in the budget, in the audit.
Correct.
And the $65 million loss, when barring any audit adjustments, will be in the range of a $30 million loss in 2020.
Right.
And that's all because of the allocation of DSRIP right? Where you put
Between those 2 years, yes.
2019 and 1 quarter into 2020. That's really what that's all about.
Well,
That's right.
It's DSRIP and it's CARES Act. Right?
No, it's just DSRIP.
No,
It
I'm
should-
talking about 20.
Oh, the positive, the 6 to 35 million or 30 million?
Yeah, because there's between DSRIP and wait a minute, in DSRIP there is 0 I'm sorry, in DSRIP in 2020 is 15,000. That's that other part that you allocated.
That's
And then
right.
In federal and state aid, there's $21,000 in there. Right?
Yeah, let me just go back up to that. Yeah.
So
The,
people understand that.
the federal and state aid of the 64 million, that includes the CARES Act revenue.
Right. And how much of that CARES Act, how much of that 64 is CARES Act? Do you remember? Is it 20?
Through October, it's 35 million, and I think we projected 3 million a month going out, so it's about 41 million. The other piece of that is 20 million of VBP QIP.
Right, which we won't see again.
That's right. It ended with DSRIP.
Right, okay, all right. So, but
Okay.
that, I just need to be, and I'm not trying to be a Debbie Downer, but just needs to be in full disclosure for the board to understand that those dollar amounts are one-time pickups that are not ongoing. So that in terms of, going concern issues later on, everybody's aware of that. Of course,
Correct.
who knows what's going to happen with there may be more CARES Act money. We don't know. So, but
Right. Yeah, we don't.
Okay, all right. I just want to make sure that when we present that 607,000 is somehow, we got to make sure it's, and we'll talk
Yeah,
about it.
if you scroll down to the bottom of the page, I tried to disclose that so everybody saw that
Yeah.
that's,
Yeah.
it just says the 2019 reflect audited amounts adjusted for the district award of 50 million.
Yeah.
And the split of the 9/12ths and the 3/12s.
All right. We have
But
to talk about-
I didn't want to hide that. I wanted everybody to know that as
Yeah,
well.
yeah. But when I read that thing that Mitchell Titus sent, it sounded as though we can't allocate that into 2019. That's why I'm concerned.
No, you're right. But for budget purposes and for this package,
Yeah.
I just wanted to show the board and everybody who sees our budget that the district dollars, the way we earned it, are what we reflect here.
I see.
That's all. It's just for a comparison year over year to see, and
Okay.
it kind of ties into.
I understand what you're doing. Yeah, okay. But you know what? You ought to put an asterisk up there on that 607 and tie it into an asterisk down there so people, it draws them down to the bottom of the page so they see it. Just just for the purposes of disclosure.
Yeah, sure, we could do that.
Yeah.
Okay. Just the next page is the same numbers,
Mhm.
but it breaks it out. You can see by each entity.
Yeah.
And just scrolling down to the operating results, I'll show you our $116 million loss is broken out, 96 million that we'll lose at Newmick and 20 million that we'll lose at A Holly. That's the only point I'd make there. But let me just go down to the next slide and show you for the analysis that we just did. We're budgeting a loss of 20.4 million in 21 for A Holly. If those two new programs are successful, and success being the 150 new residents, that will add that 6,186,000 back in net revenue to those operations. Because we've lost 100 people to expirations in 2020 because of COVID, and 60 of which, like I said before, were the Korean program. And I talked to the people at A Holly and they said that that's starting to come back. If we can just restore our volume to pre-COVID levels, that would add back that 8.3 million that we've seen a loss on this year. If you then add to that the revenue cycle initiatives that we talked about earlier of 2 million, future losses at A Holly should be in that $4 million range, not the $20 million range. And that's predicated on the new programs being successful for the Chinese Indian programs. You can go there. Let me, and this is going to open up the discussion we had before. But scroll down to the next page, and this is what I'm going to predicate this on. Everybody received this sheet, and I know everybody was almost totally confused with it. What this attempted to do is take those cash flows that we talked about with the committee last time. You can see there that based upon starting with historic levels and that 3,700 FTEs that we've always run over the last couple of years, if you look at the four columns on the right, you can see that we would be losing $130 million in cash every year if nothing changed. Let me go back now to the prior slide, because what I tried to do is simplify that because it was so confusing to everybody. Based upon historic levels of staffing, we would lose that $130 million in cash from operations every year. What we've built into the budget of reducing our staff down to the lower level, the numbers we were talking about before were 51 million in budget initiatives and operational changes. The 57.5, that second number, reflects what the Indian program and the Chinese program will ultimately yield at maturity. So if those are successful, that $130 million loss in cash, based upon the current budget that we have in 2021, will be reduced by that 57.5. If Nassau starts paying us the $6 million more that we bill them than they pay in our debt service on a routine basis, that will also eat into that cash drain every year. And the last piece that we've talked about in certain aspects over the last couple meetings, we only get 50% funding for Dish IGT at Newmick and the upper payment limit payments that we get with Holly. If we can convince the state to treat us like they treat the SUNYs, namely SUNY Downstate in Brooklyn and SUNY Stony Brook out in Suffolk, if they were to fund the local share like they do for SUNY, we could get them to fund us for the other $53 million. That would bring our annual cash deficit down to $12 million a year. Just scroll down a little more. That means that we have to, over the next 2 years, come up with additional budget initiatives and operational changes of $12 million. And if you put it in the context, no, just go up a little bit. If you put it in the context of what we're achieving in this budget of $57 million, that shouldn't be hard to do. It's about 25% of what we've accomplished in this year's budget. Now just scroll down. And this is what it would end up being. Right now, the state supports us through the NISHIP deferral program of $60 million. And if they treat us like the SUNYs of the additional $54 million, we'd be asking for New York State support of $114 million. Our budget initiatives that we have in the budget of $57 million and the additional amount we need to sustain ourselves on an ongoing basis would total $70 million in budget initiatives. And let me just show you why I'm saying sustainability. If you go to the next slide, there's a lot more detail to this, but the $130 million in that first line, the third line down, that's what I started with. The green box is the budget initiatives detailed out by all the different components of it. And you can see the budget expense reductions of the 33.5. I'm attributing the amounts that we're seeing right now, and this was with a starting point of September 1. From September 1 to March 31st of next year, we're going to save $19 million off of our starting point of the higher staffing. Just scroll down a little bit. The other pieces that will impact this is we're working with the county to get them to pay what they currently owe us of about $30 million. I've put 25 in here because that's been the discussions that they're willing to try to do a bond offering on. I don't want to be overly aggressive on trying to accumulate cash. The state plan amendment that I just talked about again, if we can convince the state to treat us like they treat the SUNYs, that will be the other source of revenue, of cash and revenue that we would see. And on this one, because there's a little more detail, the future budget initiatives that we need, just scroll down, is the 14 million. You can see on this that the cash balances that we're starting with as of March 31st, 2021 of 145 million, or that 144.9, because of our starting point of doing the budget this year, that does go down to 71 million. And then if we achieve those initiatives and the budget that we just talked about, the other 14 million, our operating cash balance would be maintained at the 57 to $60 million range. That's why I'm saying this is components of sustaining ourselves and not bleeding any longer. The one thing I would note in the blue box there is I have not included any of the available CARES Act revenue that we have. That's currently in the $87 million range. We've taken 7 of that and it's included in the 2021 budget. But besides that, the other $80 million in CARES Act is not being used in this scenario to sustain ourselves. Our $60 million ongoing cash balance that if we accomplish all of this, will sustain us without using that $80 million in CARES Act.
I guess my only comment is it's not going to be easy with the state's financial condition to expect them to kind of bail us out on the local share. So I think we have to recognize that that's going to be a pretty difficult thing to get done by March.
No, I agree. And if I scroll up, you'll see it's not asking for that until the third column over. Just go up a little bit, which is April 2022 to March of 2023. We recognize that the budget right now, they have a $14 billion budget deficit, projecting a higher one next year. And it's going to be an effort to do that. On a preliminary basis, we've talked to Erie County. They're in a similar financial situation as us. And we're trying to figure out how we would approach the state, maybe as a collective way for all of the public benefit hospitals, that being Erie County, us, and Westchester. It's just in preliminary stages to see how we'd approach the state to.
That'd be a good idea. No, it's be a good idea. Let me ask you, I've still got a lot of questions. I don't think we're gonna get them all answered tonight. But your cash flow, well, what you're using here for cash flow, where you're presenting it, that doesn't include any, is there any capital expenditures in there?
There's $12 million in capital expenditures, which is our routine capital expenditures. What we talked about in the cash flows that Bobby Colati was concerned about, the $100 million,
Right.
that's not included in those because that was to re-outfit the entire campus and get it back up to current conditions that we would need it to be. What's in the cash flows is about 12 million in
Yeah, I
routine
think
replacements of equipment at Newmick and at A. Holly, and infrastructure.
I think we ought to have some type of schedule that looks at that on the, the 4-year, or, I mean, I know that by 2027, we got to have certain things done, sprinkling, and there's a whole list of things. And we probably should have some schedule, because I think to get ourselves into compliance, and probably so we don't skirt safety issues at some point, like with gases and everything else, we're going to have to do more than 12 million a year. So we got to put together some type of realistic schedule other than the 12 million. Do you think, I don't think the 12 million is going to suffice, is it, to keep us open?
It's what we've historically been doing.
I understand that, but we're falling behind.
Agreed.
It doesn't equal our depreciation.
Our depreciation is just a little higher than that. It's about 15 million.
Yeah, 18 million. But so, so we're under budgeting, which is kind of, we're eating ourselves as we go forward. We're not going to be able to sustain ourselves in terms of the plant and keep ourselves
Yeah, agreed. Over the last 2 or 3 years, We've gotten the transformation grant of 25 million for capital and a smaller $10 million grant for the essential hospitals.
Mhm.
So we've been doing it on capital grants provided by the state.
Okay.
And that's
Let
why,
me-
go ahead.
Let me stop there and ask Jan and Waylon if they have any questions, because we've had
From
me and Bob and Bobby the same kind of questions. So Jan or Waylon, do you have questions you'd like to ask of Rich?
last
I-
night.
Yeah, from last night.
Go ahead, Waylon.
No, I don't have any questions. The questions that have been asked are good questions, and so I think it answers some of my questions, or my questions was put out there through there. So I don't have any different questions.
Jan, how about you?
Well, I thought I understood this prior to the meeting, and now I feel a little bit more confused. So, well, I feel confused. So I'm looking forward to getting the information that you and Bob have asked for, and Bobby. I know that the staff and Richard have put a lot of work into getting to this point. And I guess my biggest concern is that we are depending on a lot of things hopefully happening. If the state will do this, and if we will get certain other operation and other things to be able to make sure that the hospital is sustainable. So that's one of my biggest concerns. Really trying to increase patient volume, getting more individuals to utilize the hospital services, cutting staff, while I'm sure that, or just maintaining a certain staffing level, I'm sure is important, but that's not a way to really sustain anything. And so I'm just more concerned about what other proposed changes are going to happen to make things better. And, but like I said, I think that they've worked really hard on this, and you've asked a lot of really important questions, and I'll just be waiting for some more answers. Thank you.
Okay, thanks, Jan. And I join Jan. I think we all know there's a lot of effort been put into this budget, and the questions don't reflect any lack of work, but just
No.
perhaps getting a
Right.
better understanding of how the numbers are developed.
You know what? I do have one question. The stock market has rebounded. So while I know that it took a hit, the pension plan valuation took a hit because of March 31, but now we're back up. So how does that play into our expense now?
Next year.
How that will play in, the state has given us an invoice that what we have to pay by each tier of our employees. It goes from tier 1 to tier 6, and it's a percentage of salaries for each tier. The main tiers are 3 and 4, and the pension that we paid in 2020 was 15.8% of salary. With the meltdown of the market, they gave us a projected amount that we're going to pay of 18.4, I believe it was, for those tiers, and that's the lion's share of it. The rebounding of the market, what we will see next year will be a reverse of what we saw this year.
Okay.
Because the market melted down on March 22nd, and I think it was the S&P was down to 22,000, where it had started a week earlier at 27,000. By March 31st, when the actuaries at the controller's office value this plan, they take a snapshot at March 31st, 2020, and they say, here's what the market is. And they evaluate the plan saying, okay, your investments lost so much this year. Because the loss is made up of dividends they got, interest they got, and the change in the value of the stock. And with a big hit like that of about 20% reduction in value, we've seen, and you saw it, the GASB number, we had a $33 million loss for GASB on that. And that's our share of the overall plan by the state. That will only be for 1 year, because when if everything stays as it is right now, to your point, Jan, that the market rebounded and it's close to 30,000. So it went from 22,000 when they evaluated it to 30,000 for that one index. That's almost a 30% yield on the investments right now. Their expected rate of return is only 6%. So the $33 million loss we saw this year, when the actuaries do that again on March 31st of 2021, I would truly expect to see not a $33 million loss, but maybe a $40 million gain. The percentages on our salaries should go from that 18% where it went from 15 to 18. I'm assuming it should go down to something more like 11 or 12. And that's the normal course of the pension.
Okay,
So,
so,
and what they do with all of this, they take all of these impacts and they spread them out for the next 5 years. So right now, we're going to see this negative impact that we saw this year for 5 years. Next year, when they do it, we're going to have a positive impact that offsets that for the next 5 years. So the next 4 years should it should zero itself out, if not be a little positive. But for this year's budget, we have to stay with what the state plan has told us so far.
got it. Thank you so much.
Welcome.
Rich, I happen to be an actuary. And I can tell you, you really can't predict what's going to happen March next year. It could be another loss. We just don't know.
No, I agree. And that's why I said if everything holds as it is today, the stock market, the biggest impact was the stock market was at 27. A week before they evaluated it on March 31st, it went down to 22,000 for that one index. Since then, it's come back up to 30,
Right.
which is a 10% increase from the 27 even before the meltdown. I'm just saying if everything holds constant as it is today, we would probably have a positive pickup. But you're right, John, if the market melts down tonight, all bets are off. You're right.
Jan, did you have a comment you wanted to make?
My comment is let the market stay high.
I'm for that.
Amen. So before the committee, we have to decide whether we're willing to send this forward to the full board. I know there's a lot of questions outstanding. So I'm going to poll the committee and ask for your opinion of whether it should go forward, starting with Jan.
I think that if Rich can get back to us, if we don't understand this and we bring it to the board, it's going to be a disaster. And so it's really important that the people on this committee are able to understand what we are trying to propose so we can at least defend it if somebody else starts to question it. And I don't feel, look, I'm going to defer to you and Bob. You're an actuary. You guys have much more experience with finance than I do. So it's important that I think we hold off until you're satisfied and we can explain what we need to if there are questions at a board meeting. Otherwise, we'll be in the board meeting until 3 o'clock in the morning.
Wayland, your opinion?
I agree with Jan. I think that there's a couple of things that need to be a little clearer to us. And I do understand that this effort is based on a lot of hope it happens. But, from a political standpoint, some of the hopes, it's going to take effort of the board members, the community to push some of those hopes to our higher state elected officials to make sure that they do something to sort of help the hospital. And, and these hopes are not really that bad. It gives us a benchmark to sort of see where we're going and if we could obtain that. But there's still a couple of things that have to be answered, I feel.
Bob?
Well, I think we have to wait. I remember too, we made a commitment to Bobby that we would give the board 2 weeks advance. So we're not really ready to do it yet, but we probably need another meeting, maybe 2 more meetings on this, but because I've got more questions now than I had before, and also we have to go down through the cash flow stuff, which we didn't do tonight. And that's something that we really need to do, but we really can't do that until we answer the other question. And So I'd be in favor of us holding at the board meeting. If it's the technicality of a budget, we could just pass, John, you could make a motion to do a continuing resolution and the corporation can just function on the existing budget until we back in January.
Yeah, I think we all agree that there are outstanding questions that are, and I agree with Jan, if we can't, and we spent hours on this, clearly understand what's going on, we can't expect the board to appreciate what's going on here. So, Rich, if you could work on the issues that we've raised here, and as soon as you have that material ready, distribute it, and then we'll schedule another meeting. Hopefully, at that meeting, we can resolve many of the questions. But until we have a consensus here that we understand the budget and agree with it, we can't really move it forward.
Yeah, I do want to say, I appreciate all the work that Rich has done. And I don't think any of the committee has any questions about integrity, honesty, competence, none of that stuff. I mean, you're working hard on
Not
it.
at all.
And there's a lot of balls in the air here. This is not an easy thing to put together. So, but please take our questions with the intent that they're offered. It's just that, I don't know I'm trying to understand it. That's all.
Yeah, no, I appreciate it. And the only thing I'd say is I'm presenting the budget, but this is our collective budget. It's not a finance budget. And there was a lot of effort put in by all of the operating departments to start from ground zero and build this, given what their current operations are. I'm only presenting it because finance, collects it all together.
Yeah.
I think the majority of us understand that you can't do anything if you don't have input from all the other departments of the hospital. Only they know their needs and how they're spending their money for whether it's salaries or supplies, whatever. So I appreciate what a job it is.
It's a hard job. It's a hard job. And
Really
Yeah, Bob and Jan and Waylon and I think all would say that we just want to make the product better by understanding what the questions are. And so it'd be best for corporation as a whole and finance in particular. So we want to thank you for your efforts and we look forward to the next.
Well, you know what, John, though, are we waiting until January or are we going to have another finance committee meeting before the end of the year? And how much time will Rich need? I'm sure you and Bob will be sending him more questions. So what's the time frame?
I'm hoping we can turn this around quickly, Rich.
Yeah, I can get most of the information together pretty quickly. I'm not sure what Dr. Colati is going to send as questions, but I'll try to respond to those quickly as well.
So I would hope that we can schedule perhaps something next week. In anticipation of that, I'll communicate with Megan and Bob to see if we can put something on the calendar. And
Okay.
committee's available for it. So let's tentatively plan to have a meeting next week. Is that
Okay.
acceptable?
Thank you, yes.
Okay.
Well, I want to thank everyone for delaying their dinner here and staying with us to this late hour. And hopefully, I think the effort here is going to show that we've done a good job and the product that actually goes to the board will be that much better. So thank you all for this evening.
Right.
Thank you.
Thank you.
Your
Take
financials
care,
or not?
everyone. Have a good rest of the week.
He asked for questions, not yeah.
We don't need to-
Okay, just a question. Are we approving the October?
Yeah, I'm sorry. We didn't approve the financials. So I don't know if you would like to do that tonight or if you're going to hold off on that.
Megan, let's hold off on that.
Okay.
We'll be meeting next week, so we can do it
Okay,
then.
so I just need a motion to adjourn.
Yes. Motion to adjourn?
Second,
Okay. See you all next week sometime.
okay.
I'll see you guys on Thursday.
Thank you, everybody.
Wednesday we have a board meeting. Wednesday.
Wednesday.
Board meeting is
Wednesday
Wednesday.
night. Okay, thank
Board
you.
meeting next, yeah, I know.
Good night.
Everybody.
Yikes.
Bye, Mr. Donnelly.
Bye.
Bye all.